Hi, welcome to this micro lecture from the ACE Your Clinical Placement series on how to structure a formal case presentation. My name's Matthew Links, I'm the Discipline Lead for Medicine Placements at Bond University, here on the land of the Commonberry people on the Gold Coast. This lecture is aimed at medical students who've been taught the skills of history taking, but have to put it together for a formal case presentation. Perspectives at that of a medicine placement, surgery or paediatrics will have a slightly different spin. Case presentations are a key activity as part of clinical work and as an assessment of your clinical reasoning. There are different formats, and today we're talking about a more formal case presentation. The key issue is that you need to give the examiner exactly what they want in the format they want it. Reading minds is difficult, so ask. Every examiner is different, has their own preferences, so give them the information they prefer. What format, how much detail. Because everyone's busy, you're best to be concise and have the additional information up your sleeve. So these are the headings of a traditional formal case presentation. Structure's your friend, so use the structure. We'll go through each of these headings in some more detail. The identifying information is straightforward. The chief complaint's primarily the symptom complex they present with, but you should selectively add information that you want to highlight from other parts of the history. You're summarising. Here's a short example. The history of presenting illness is as you've been taught at medical school, but remember you don't have to present every negative, and the things you do include are a signal to the examiner that you're thinking about diagnosis and management. Here's an example. Focuses on a concise chronology, assessing impact, just the relevant negatives, trying to put in some context, consider things that help you with the differential diagnosis, and tell them why they presented. Now, if the patient's been in hospital for a while, you should summarise the progress in hospital, outlining key investigations, treatment, and clinical progress. The active medical problems is much more than a list, but it's not an essay. It's not a comprehensive account of each problem. You want to just give a picture of severity, impact, and potential issues. For example, type 2 diabetes, diet control doesn't check their sugars. It's a snapshot. Listing medications and allergies is straightforward. Use generic names. And when listing the medications, it's helpful to identify if the list has been verified or accurate. Consider who administers them and if there are adherence issues. The social history should always include who's supporting the patient and their living arrangements. But you should draw on the other social factors that impact on their problems, such as other stressors, caring responsibilities, issues of social determinants of health like access to care, understanding the patient's goals, and their health literacy. I'd also encourage you to include one personal fact that makes them real as a person and shows that you understand something about them. For physical examination, you want to comment on vital signs, describe key findings, just the relevant negatives, and bundle the negative together findings as normal. The key step is the assessment or the formulation, and a good assessment or formulation leads you to the good diagnosis and plan. Commit to a diagnosis, not just the presenting symptom. Chest pain's not a diagnosis. And formulate, is this a diagnostic or a management problem? And don't forget to identify the patient's main concern. So here's an example. It's got a summary, a diagnosis, the issue, and the patient's main concern. The plan doesn't need to be everything, but generate a plan that covers treatment, further investigations, monitoring, and has the end game in mind. In this case, discharge. I'd encourage you to think big picture about the elements of the plan. And I recommend that you be prepared to give more details if required. Have some spare notes or slides up your sleeve. For example, the history of any related problem, like his colon cancer, or his diabetes. Be prepared to give a more detailed account of the presentation or the social history, etc. You don't have to say everything, but be prepared to expand if required. So this is a brief guide to the formal case presentation. Having the right structure that meets the examiner's expectation is key. Structure keeps you organised. What you leave out is as important as what you put in. Polish your formulation till it sparkles, and be prepared to provide more detail. So case presentations are a great way to learn. Try and get the most out of them. For additional resources for Bond students, recommend our Learning and Practice Handbook on the medical program community side of iLearn, and here are some other resources that may support you. Remember, patients can teach you a lot. Good luck.